name is Jade, and we're going to talk about stroke, what it is, risk factors, signals, and care. A stroke, also known as a cerebrovascular accident, is caused when blood flow to a part of the brain is cut off or when there is bleeding into the brain. A stroke is usually caused by a blood clot called a thrombus or embolus that forms or lodges in the arteries that supply blood to the brain. It can also occur due to a ruptured artery in the brain caused by a head injury, high blood pressure, or an aneurysm. Risk factors for stroke are similar to those for heart disease and include age, gender, and family history of stroke or cardiovascular disease. Risk factors are increased for a person with history of high blood pressure, previous stroke or mini stroke, diabetes, or heart disease. Signals of a stroke include facial drooping or drooling, weakness or numbness of the face, arm, or leg, trouble with speech, loss of vision or disturbed vision in one or both eyes, sudden severe headache, dizziness, confusion, agitation, loss of consciousness, or other severe altered mental states, loss of balance, or incontinence. We use the acronym THINK FAST to identify signals and get advanced medical care as quickly as possible. Face: weakness, numbness, or drooping on one side of the face. Ask the person to smile. Does one side of the face droop? Arm: weakness or numbness in one arm. Ask the person to raise both arms. Does one arm drift downward? Speech: slurred speech or difficulty speaking. Ask the person to repeat a simple sentence. Are the words slurred? Can the person repeat the sentence correctly? Time: try to determine when the signals begin. Time is critical. Care for a stroke: call 911 or local emergency number immediately. Note the time of onset of signals and report it to the call taker or EMS personnel when they arrive. If the person is unconscious, make sure that he or she has an open airway and care for any life-threatening conditions. If fluid or vomit is in the person's mouth, position him or her in a modified Haynes recovery position. Stay with the person and monitor his or her breathing and for changes in his or her condition. If the person is conscious, check for non-life-threatening conditions. Offer comfort and reassure, as a stroke can make the person feel fearful and anxious. Often he or she does not understand what has happened. Have the person rest in a comfortable position. Do not give him or her anything to eat or drink.